Welcome to another episode of Josh Langley Gets to Know. Now, today we're going to talk about the very, very important topic of mental health in young people. It's one close to my heart because obviously I write a lot of my books about mental health and well-being for kids. Now, this is mainly for, I suppose we're talking about kids, but also for teenagers. So we're going to be talking to Rebecca Watson. Rebecca Watson has been a counsellor for 12 years. She's worked across all different aspects of counselling, from sexual assault to family violence to working with adults, working with kids. And now she's finding that she's working with a lot of youth. And so that's why I wanted to speak to Rebecca about what's happening with our young people today. What are they facing? What issues are they going through? How parents can help. So we cover a lot of different topics, and we go to places that, I didn't think we were going to go, but we did. So you'll enjoy that. Now, look, I'm going to give a trigger warning here. We talk about anxiety, we talk about depression, we talk about suicidal ideation, and a few other topics. So if you feel triggered by anything or anything that we talk about raises something in you, please talk to someone. I can't stress that enough. Talk to someone about whatever has been raised. I'll put all the links and all the phone numbers in the show notes, okay? So let's all learn a few more things about young people and what they're going through mental health wise. And let's get to know Rebecca Watson. Rebecca Watson, welcome to my little chat show. How are you?
I'm great, thank you, Josh. Yeah, and thank you for inviting me. How are you going?
Look, I'm going really well, really well. Now, look, in the
Yes.
introduction, I gave people an idea, a brief background about what you do and sort of a little bit about where you've come from, just only a little bit. But obviously, we want to talk about mental health, young people, and where you fit into all that sort of stuff. Because for me, mental health for young people is so important, and I don't think we actually talk enough about it. As you know, most of my books are related to mental health and emotional well-being for kids, mainly primary school kids. But it's sort of any opportunity I can find to talk about it is a great thing. So that's why I wanted to get you on board here to pick your brain, talk about where you've come from and about what you're doing with mental health for young people, okay? So the first question is, I know that's a long intro. Well, the first question is, how are young people faring in these COVID-19 times? How are they going?
The mixed, mixed, I'd say. For some young people, it's been an absolute relief because they no longer have to go to school,
Yep.
and they're finding staying home and not having to deal with the dramas of school or bullying or the pressure of academic achievement and ongoing study and homework has been an absolute was given them freedom, I guess, from that stress. But for others, it's really been very difficult and challenging for them because they've lost the connection to people and they've lost routine, and they're being exposed to a different life experience, I guess, that they find quite challenging. Yeah.
And that's what I found. I'm speaking to a lot of parents with primary school age kids, and that they were saying the exact same thing. They miss their friends so much, and that interaction. They actually started to feel depressed after a while. But now that school's gone back and they've gone making those connections again, things have recovered. Are you finding that teenagers are recovering okay with this, or?
I think there's a lot of resiliency in our young people, but for some it has been quite difficult, and I guess it depends on family backgrounds as well, because that would make it hard if there's mental health or drug and alcohol or family conflict or family violence. That would make it very hard. But what I found as far as supporting them is that during COVID lockdown, for some, it was actually easier to engage over the telephone, which is how counselling was being provided. And for others, that was something they were so uncomfortable with that they'd prefer to wait, and they didn't access services, and they're starting to come back in now. So as far as how they've coped with it, I think they've all found a way to deal with it. Whether that's been a healthy way or not, we're not sure yet. We're only just getting back into our face-to-face work.
So I was going to say, do you think there's going to be some long-term effects from this that will take a while to get over?
That's a big question, Josh.
Yeah. Or is it too early to say?
It might be too. I mean, you can kind of guess at what some of the impacts might be for some young people, but I think it's about being able to adjust. I think it's about being informed and people talking to our young people around what's happening so they can understand it, and explore how they can, for instance, connection. How else can you do that? Let's find other ways.
Yep.
So I guess it's about adjustment and supporting that.
Okay. Now look, the point of this show is obviously to get to know the person behind the work they do. Okay. Now you've been a counsellor for quite a while now. Now, am I right? You mainly specialise in young people, don't you?
Well, at the moment, I'm working with young people, and
Okay.
But
so what made you get into counselling? What was the motivator? What was the driver? What made you go, I'm going to get into this field?
I was working in a training section for a very large organisation back in the UK, and that was where my strengths were being highlighted, is in how I was able to sit and support people from all walks of life. And I guess I wasn't passionate about what I was doing back then, and I kind of thought about it, and I have my own history as well, and I thought I might look into this. So I decided that I would study counselling, and that was the start of the journey. And the reason behind it, I guess, is through my own experiences. It's amazing the impact of a relationship, even if it's a 5-minute meeting or a lifetime meeting. The impact can be really positive, really warm, really helpful, or it can be really challenging, difficult, or can actually impact on somebody for a long time.
I was going to say the role of the counsellor, for what your role will be to meet someone that as you said could make or break the situation. It depends on where they're coming from and what they're bringing, and how you have to then be I suppose as open as possible to receive and to listen and to I suppose not bring any of your own judgments to that as a counsellor. How easy is that to do, to be able to sit and listen and be open?
Well, I guess it's something that we were trained to do, because often when we have conversations with people, our initial thing is to want to help, is to jump in with a solution or an idea or our own experience. So through the 3 years in my degree of study, we did personal growth, we did counselling skills, we were videoed, we were critiqued, we were watched back, we were guided, we were taught, So we were actually, they call it active listening.
Yes.
And it's a taught skill.
I'm trying to remember to do that right now. And stop going, now what's the next question? No, listen to Rebecca, Josh. Listen to Rebecca. So I've got to ask you, so because I know that interaction for a client, if you want to call them a person who's coming to see you, is how important is for them to be validated by telling their story. How important is that?
It's really important. I think the most important thing is they feel comfortable with who they're sat with. That's really important, because if you don't feel comfortable, it's going to be difficult. So I always say to young people, or anybody actually that comes, if at the end of this session with me you don't feel comfortable working with me, that's fine. I'm going to ask you, and it's okay to say if you don't, and we can look for somebody else that may be a better fit for you. So give them that option.
Okay.
Make sure I'm the right person. Then to actually... I
was going to say, do most counsellors and therapists have that? Do that? Say that at the end of their sessions?
I hope so. I'm I'm not, if I'm clinical supervisor to someone, we might explore things like that. Yes, yeah, it's hard to say, but I hope that they do all realise that the power in that correct fit. I would think most of them do. Yes.
I think it'll be interesting to see what other people, what their experiences are talking to a counsellor or a therapist, and whether they have, they say that, which then, because you may be sitting there in the session going, I'm not feeling right, I'm not feeling comfortable. And then you just feel obliged to keep going when really it may not be the best avenue to go down, or working with that person may not be the most beneficial. So I'll be interested to know if anybody else has got any comments. They can leave them down below in this situation. But I'm glad you do that, because then that allows people to have that out if they want that out, or they can feel more comfortable.
Yep. And I guess another thing is sometimes there aren't the resources, like there's not the opportunity to offer that. So if you're somewhere remote, or it's private practice, or it's working in a school environment, you're the one person. I just happen to work in environments where there's more than one counsellor or other services around. But your initial question was how important is for a story to be heard, and it's so important, because I think for a lot of young people, that feeling misunderstood or not understood or not feeling heard, causes a lot of distress or frustration or anger. So really listening. But the other thing for me is to take that story and hear it and try and imagine what that person has experienced emotionally in their body during that, whilst they're in that space, to then give them that back, to reflect back on what that actually was like for them, to give them a sense for themselves.
Yep. Then that would actually, that's the validation that person needs to go, I have been heard, I haven't been dismissed, I haven't been ignored, and therefore that the healing or the starting of that can then happen, can't it?
Yeah, can.
Yeah. Okay. I mean, I suppose I can only relate it back to when I was a teenager, and I didn't have a very good time, but there was no support network. There was no. I mean, we're talking, not 100 years ago, Rebecca, but it was pretty close to when I was a teenager. But there was just nothing to support you, and I look back and go, well, where would I have gone? Who would I have spoken to? And I would have had no idea, as a 14-year-old going through what I was going through. There was just no, even at school in those days, there was no avenue to go to speak to someone, or I think there may have been a school counsellor, but in those days it was like shame if you had to go to a school counsellor, and maybe they were just a guidance counsellor going, oh, you need to do this when you go to university or something like that. How different is it now for young people to access these services, or for parents to find out on behalf of their kids? What's it like now?
I think there's a lot more avenues available. Whether they're easy to find is another thing. So often there will be, especially in high school, a school psychologist present in some of the bigger ones. And then I know when I was working for a service youth focus, they would actually have in-kind. So a counsellor would go 1 day a week around to different schools for referrals. I guess it's finding the right service. So there's services out there now. It's finding the right one, and that can be really hard, because if you don't know what you're looking for, how can you find it? So my advice to anybody would be to go to their GP and have a word with them. Or ring up a service and just ask, say, I'm looking for a service that supports family violence, or I'm looking for a service that supports anxiety or depression, or I'm looking for a service that supports young people, or marriage, or couples.
Are you finding that it's more parents that are coming to where you're working now that are referring that say my child needs help, or is it the child instigating it?
It's both.
Yeah,
it's both. And sometimes it's referrals directly from a young person or a parent or a carer. Other times it'll be from a school or a GP.
Right, okay.
Are predominant referrers.
Okay. Now, do you think that most people out there in general public land sort of know what the stats are with mental health in teens? Because I've been on the Beyond Blue website, and I think these stats I'm about to quote are a couple of years old now, so they're obviously no effect of the COVID-19 and stuff. But some of the stats are pretty astounding, and it said suicide continues to be the biggest killer of young Australians. Over 75% of mental health problems occur before the age of 25. 1 in 7 young people aged 4 to 17 experience a mental health condition in any given year, and almost 1/5 of all young people aged 11 to 17 experience high or very high levels of psychological distress. I mean, they're pretty alarming stats for our young people, and these are the people that are going to go on to be our leaders, our business people, our politicians, and all that, and they're going through these situations now. Do you think now it's totally different to what it was 30 years ago, that the kids are facing so much more psychological stress than years ago?
It's a good question, isn't it? Because it can be around, what they're experiencing, expectations, changing in the way that we live, changes in our food sources, changes in our activity levels, but also there's the change in what we actually record and how we identify and name and label things as well.
In what way? What do you mean?
It may be that things are data's collected more readily now.
Yes.
And the diagnosis is a more common occurrence than previously.
Okay, that makes sense. Whereas you go back 30 years ago, someone like myself would have been one of those statistics, but back then I wasn't, because it wasn't recorded, and those data collection wasn't the same, and you weren't diagnosed the same, and that sort of thing. It was just totally different. So it could be the same, but just the way we collect stuff. Has social media, are you seeing the effects of social media on young people, the bad end of that?
Yeah, a lot. I guess because it's constant contact. So if you are being bullied, or you don't have very strong self-worth, then it's a very easy platform for people to attack you or put you down on. There's the competitiveness that comes with imagery or achievement or numbers of friends or what you're doing or how happy you look,
Right.
There's also the fact that young people, it can be very addictive too. There's a dopamine
tell me about it.
release.
Even I'm addicted to it.
Yeah, and every time you get a like, Josh, you go, whoa, your brain goes, yes.
Exactly. My endorphins go, whoo, even if it's just 2 likes. So if anybody wants to like this thing, click like, and I go, woohoo. So what do you offer any advice or anything to someone who is finding they're on the negative end of social media attacks or bullying or anything?
My first thing that comes to mind is to go and talk to somebody, whether it's a parent, a friend's parent, a school teacher, student services worker, a counsellor. Get some support, talk about it, and work out what you can do. You can block people. You can turn off your phone. It's very easy to feel driven to need to read what's being written, but is that helpful? You can, try and set boundaries with friends if they're sharing things with you that are unhelpful to you, and say, look, when you tell me this, it's not good.
Yep. So it's about setting out little strategies and little ways that they can prevent that input, just watching and seeing all that negative stuff coming in, isn't it?
Yeah.
Yep. Okay. What can parents do if a parent is seeing something? What do parents need to look out for in their young people to think, maybe I might need to get some help here? What signs should they be seeing?
Well, as your child moves into adolescence, there'll be changes anyway. There's like a natural pulling away from the family as they start to sort of become they want to move into their own tribe, so to speak. It's a survival, primitive survival mechanism that we have. So they'll notice them not be so present. They'll be in their room a bit more. They'll be grumpier. They'll be fighting everything you say, you know.
Yep.
So I guess that's quite normal. But if you start to notice that your young person really isn't themselves, so they're very withdrawn, or they acting very differently, their mood seems quite erratic or very flat or very avoidant or anxious, then, you know, I'd get along to a doctor's, or have a chat with them first anyway, and see if there's anything going on. And
is there a way to bring it up with the teenager? I mean, because I know you don't want your mum coming in and say, right, I've seen you being moody a bit more than usual. What are you doing? What's up? Come on, snap out of it. What's the best way to approach that?
I think really openly, just rather than telling them. It's about just, you know, maybe creating an environment. Like, can you come and just have a quick chat with me, or can we go for a walk, or writing them a little note or something, just saying, you know, we care about you, and we've noticed that you're not yourself at the moment, and we're just wondering how you're going. And then if they do engage and start to speak, it's about really listening and not trying to jump in and change it for them or fix it for them or try and move them away from it. It's just about hearing that.
And I think that's one of the biggest things, is that parents naturally just want to jump in, rescue, save, fix, whatever it is, because half the time whatever they're going through makes the parent feel uncomfortable, and then they want that solution solved as well. I mean, so the trick is to step back, listen, have that child be acknowledged in what they're needing to say, and then go see a GP or something, or
come up with, you know, or if it's manageable, sort of explore what might be helpful for them, you know, asking them what we call open questions. So questions where they can't give a yes or no, but you're kind of asking them, what do you think would help? What do you think you need right now? And they might say, I don't know.
And that's
so
fair
then
enough.
You can offer a few ideas. Give them some choices or an option, and see. There does become a point though, Josh, where, you know, young people are stepping into being young adults and they want to take control. But there becomes a point with mental health, especially around suicidal ideation and things, where that you may have to step in and tell them that you're going to a doctor's.
And I think that's important, to be able to have the courage to do that when you see your child in that situation. I'm going to ask a controversial question here. Are you ready?
Okay, I'm sitting down.
How often is it the parents are the cause, or unknowingly are the cause of the child's issue, whether it's depression, whether it's anxiety, or whatever it is? How often is it the parent that could be causing that?
I don't know is the answer to that, because there's so many underlying reasons why, and I wouldn't like to say that it's the parent causing it. It might be around situations within the family. It might be around communication styles. It might be around lifestyle choices. It might be genetic. It might be friendship, peer group issues. It might be characteristics of the young person, or it can be environmental changes. So there's so many different dynamics that come into play, and I'm really getting very interested in the moment in DNA as well. So I'm that question, I can't answer that question for you. No. I guess sometimes there are things that we can do as parents, which is to support or want to look at what we're doing and see what's working well, and see what maybe could be changed a little bit or tweaked or explored in order to make some difference.
I suppose the reason why I asked the question is because if it was like maybe a direct situation where, you know, the parent is causing conflict or something like that, even whether they know it or not, but would that prevent the child from actually, or the teenager from coming forward and saying, this is the reason why I feel like this, but because it's a parent, I don't want to mention it? Is that,
Yeah,
I suppose that's
absolutely.
why I asked that, but.
Yeah, if you think about family violence, that would be one
Yeah.
occasion where maybe it's not safe to open up or say or to ask for help, or they feel it's not safe. Mental health as well. Parents with significant mental health could possibly be a barrier to accessing services. But then there's lots of other barriers too, like maybe not being able to transport yourself, or maybe feeling you're going to get into trouble with a parent, or you're going to be judged.
Yeah, I suppose that's also the kind of thing I was thinking of. That's why the child wouldn't have the confidence to come forward, because they are going to be judged, or they're going to be punished, or they're going to get into trouble, or, as you said, they won't feel safe being able to open up and talk about that. In that situation, what do you do? I suppose, what are you doing? Because you wouldn't know, because the child's not coming forward then, would they?
No, that's right. Yeah. So I guess that sometimes if the child's going to school, things might be noticed at school. Yeah.
Yeah. Okay.
And there are some online supports, like there's eHeadspace and there's Kids Helpline.
Yeah, Kids Helpline. I'll put all the contact details for this in the. Yep.
Yeah, and they're free services for young people up to around the age of 25. So there's some supports out there. And then you mentioned, which site had you just gone to? Blue?
Beyond Blue.
Beyond Blue, and then there's Black Dog Institute. And
Yep.
So there's different things out there that you can do online or over the phone as well.
Yep.
Yeah.
Now I'll put all the links to all these in the show notes, and at the beginning I've got a trigger warning at the beginning as well, because I know what we're talking about could actually raise some issues for some people. So, and it's important. I think it's important that if people feel triggered by something, they need to go get help. They need to talk to someone. They need to work with that. I'm going to end on a positive note here, Rebecca, after challenging you with that. What is the most important thing that people should remember about life, or to focus on?
There's so many different things, but what comes to mind for me is to listen to yourself. You know, that feeling you get when you kind of know something, but sometimes you try and ignore it, or and then you look back and go, oh yes, it's yep. you know, you know, and there's a reason why you know, or you're feeling something, or you've got a sense of something. Listen to yourself. There's a lot of things out there now, social media, magazines, TV, all films, all telling us how we should be, what we need to do, and really what we need to do is listen to ourselves.
Just be quiet, listen to yourself, and trust that feeling that arises.
Yeah.
I like that, Rebecca. Look, thank you very much for being with me and talking about, these are really important topics. And Rebecca Watson, thank you very much.
Thank you, Josh.
Thank you. Hi, thank you very much for watching the latest episode of Josh Langley Gets to Know. Got any questions, whether you want to say whether you liked it, you didn't like the interview, and like my hair's too grey or something like that, post a comment below. I won't get upset, okay? Now, gratuitous plug here. If you want to grab my books, Being You Is Enough, Okay to Feel the Way You Do, or Magnificent Mistakes, or all three, just go to my website at joshlangley.com.au, because it's about trying to change the world one book at a time, helping one kid just to feel good about who they are and feel good in their own skin. If we can just help one child, then they may help another child, then another one, then another one, and then that's how we slowly change the world. So thank you very much for watching, and I'll catch you next episode.